Yeah, so this is an observational study, and it was published in the Lancet, showing that 1 in 3 people within 6 months went on to receive either neurological or psychological diagnosis. So this really shows us it's not just a respiratory disease; it is more of a multi-system disease where we see these types of long COVID impacts. And this is another reason why it's really important that we keep infection rate as low as possible. There has been such a fixation on mortality rates, number of deaths, but what we're only really starting to unpick now and have a deeper understanding of is these long-term consequences and the wider breadth of long COVID. So within this, we see that patients, although we can't say definitively cause effect in that way, will develop these types of conditions. What the study was able to compare was against other respiratory diseases. So if we take that comparison against flu, for instance, 44% went on, more people went on to have neurological complications. So that gives us a good baseline in terms of, although this is not evidence for cause, certainly showing us a worrying trend that we need to be paying attention to, particularly because of the severity of some of these conditions.
Well, anxiety and mood disorders were the most common diagnoses among those with COVID. That's not too surprising, is it?
No, not at all. And again, some of these people may have gone on to develop it independently anyhow, but probably if we paint the picture of the last year as a total, we see that there have been quite severe lockdowns and other restrictions alongside isolation. So all of these factors together, uncertainty, in addition to the biological effects, we know this virus can enter the brain and damage it. So there is evidence of that leading towards some of these conditions, but there's likely more at play here as well, including the environment in which people have been living in.
What were some of the limitations of this study?
So again, one of the issues is, of course, timelines. So hopefully we will be able to monitor people over a longer period to show a bit more of the strength of the relationship between point of infection, et cetera. There were ability to compare it against people with other types of respiratory diseases. But again, at this stage, because the type of study it was, an observational, we can't attribute a direct cause. However, I would say that in general, we do know that not just respiratory infections, but other types of infections as well, such as even Zika virus, have been linked to Guillain-Barré syndrome, other diseases that affect the nervous system. So this isn't too surprising to see that an infectious disease can have these types of consequences. But again, especially for those diagnoses of dementia, et cetera, while these people were more vulnerable to COVID in the first instance, it's interesting to see the reverse of this relationship could be at play as well. However, we do have an aging population, and so we do know a proportion of people will go on to develop these types of diseases, Alzheimer's, dementia, et cetera.
So how concerned should we be? Because some people, like you say, would have had a stroke or depression perhaps in the next 6 months regardless.
Yes, well, I think that we should certainly, 1 in 3 is a pretty significant number. And I think that this study does highlight the other reasons why we need to ensure that vaccination rollout happens as quickly as possible to protect against these issues. And so in these, also the clotting relation between the coronavirus, SARS-CoV-2 virus, known to also trigger blood clotting, that, in addition, plays into some of the numbers that we're seeing around strokes, et cetera. But it all just builds the case to ensure that we don't want to, in the long run, overburden our healthcare system. And with now over 1 million people who could potentially be affected by long COVID, including these neurological and psychological conditions, this just means that we have a problem that won't just affect us in the next year, but for the long run as well.
Well, Oksana, there has been a lot of discussion about the potential risk of blood clots resulting from being vaccinated against COVID-19. What's your assessment of the information that's out there?
Yeah, so this has been a lot of flip-flopping going on in Europe based on the analysis of the pharmacovigilance data coming through. Certainly, we do know the virus itself is linked to clotting, so unpicking that can be difficult. But the concern specifically for CSVT, which is a very specific type of cerebral blood clot, there have been, let's say in Germany, over 2.7 million people have been vaccinated. About 31 went on to develop this, and more of them were younger and female. So when we compare to the UK, where this signal has been less picked up on by our regulatory body via this yellow card scheme where people are able to report any issues, could be because our prioritization system was largely based on age. So we see that older people who may be less likely to go on to develop this type of problem. Again, there is no evidence that this is causally related, but it is a good thing that these agencies are doing their job by investigating it, and it should be investigated further. But we just don't have the same signals in the UK, so it could be age related. But again, we have to really look at what the risk versus benefits are. And although there are people who have presented with this, and in a typical non-pandemic scenario, there'd be only about 2 cases per year where we would see CSVT appear. So that this number is elevated up to 9, I believe, across the continent or in Germany. And so from that perspective, whether it's something else at play will be very difficult. It will take time to uncover. It's just time we don't have. We need to be proceeding with the vaccine rollout, because literally that will save thousands of lives every day. And it makes much more rational sense to ensure that we are protecting our populations as quickly as possible, and we shouldn't be halting that. Now, certain countries in Europe have gone ahead to make some age restrictions, and rather than totally stopping the vaccine rollout, which I think, again, there was a very brief period of a blanket ban, which right now with Europe and a third wave coronavirus would not be advisable. But again, I think further monitoring, we're going to hear from the European Medicines Agency later today. They will share with us more information about what they have discovered, and the numbers are evolving daily, so it should be very closely watched, and it shows that this is happening.
Yes, we do. We will monitor that and look out for that information. We look forward to that update. Oksana, meanwhile, thank you for joining us on the program tonight.
Thank you.